Okay, so these are the questions I was told were given to you, and we will discuss these questions. So first of all, Amrita, just read the question and then we'll go through them.
Sir, number 1 is describe the method of preparing platelet-rich plasma. Describe indications of PRP in musculoskeletal disorders.
Okay.
Sir, should I read all the questions?
Yeah, just read them. So I want to know how good you are with these questions and how it is covered in your syllabus wherever you are studying. So just to get an idea. Yes. So what is question 2?
Sir, our next candidate is Dr. Ghosh, sir.
Ghosh. Okay. So
Yes.
Ghosh and Amrita. Yeah.
Yes, sir.
Okay.
Sir, second question is describe the pathogenesis and management of gout.
Okay.
Third one, define bone remodeling, distinguish between osteoporosis and osteopenia, explain management protocol of osteoporotic vertebral fracture with a flow chart. So number 4 is describe briefly the principle and indications of FDG PET scan in orthopedic practice. Mention briefly about the latest generation of cementing technique of total hip arthroplasty. And fifth one is the describe briefly the principle and indications of pulsatile parathormone therapy in orthopedics. Describe briefly the clinical implications of bone morphogenic proteins in orthopedics.
Okay. So Dr. Ghosh, you want to participate? Are you there, Dr. Ghosh?
Yes, sir, I'm there. After he finishes, I'll try one, sir.
So Dr. Ghosh, no, there's no trying. We'll all try together. So out of these questions, which one you find more difficult, or which one you say, oh, I'm happy to answer these?
So the first for platelet-rich plasma, sir, it is.
Or which one you think is okay? This we have covered, sometime discussed during your training. You're happy. Are these any of these questions discussed during your training, or you find happy to talk through them or write
Yes,
something
sir.
about?
We have discussed about gout, sir, mostly.
Mostly, okay. Gout is reasonably easy. Okay, where are you studying? What's
Sir,
your first name, Ghosh?
Sir, Mriganko.
How do you spell that?
Mriganka. Mriganka.
G-A-N-K-A. Mriganka.
Yes, sir. This is pronounced as Mriganko, sir.
Mriganko. So what is Mriganka? Has it got anything to do with deer?
Yes, it is something. The eyes of the deer. It is sometimes told as such.
Okay.
And
so gout is one you're reasonably happy. So we will go through these questions and then see how comfortable you are answering them in next 1 hour or 1.5 hours. Okay.
Okay, sir.
Okay, so we will discuss each one of them. These questions are 5 questions randomly written. So I have actually made them slightly more so that we can discuss them in a sequential way. So I've changed the question a little bit. So it is say define bone remodeling, distinguish between osteoporosis and osteopenia, explain the management protocol for osteoporotic vertebral fractures, describe briefly the principle and indication of pulsatile parathormone therapy in orthopedics. So we will try to answer this. Forget what is A, B, C, D there, but these 4 questions first. Yes. Okay.
Okay.
Okay. So Amruto, tell me what is your understanding of bone remodeling?
Remodeling.
If somebody asks you what is bone remodeling, what is your understanding? Have you got any?
Sir, it is actually occurring in the last phase of fracture healing or bone healing with the help of bone remodeling units.
Okay, so yes, that's good. That's one way, one place where you can see bone remodeling after fracture healing. Do you think in the bone we are born with? Let's say today, how old are you today, Amrut?
Sir, 31.
31. If I say at 41, all your bone will be replaced, Do you think I am talking nonsense?
No,
So
sir, it's constantly changing, sir. Yes, sir.
body is constantly changing. Not necessarily you got a fracture every day and you have to remodel. Remodel keeps on happening, yeah?
Yes, sir.
And we need to understand this remodel, because if you understand remodel, you understand a lot of diseases associated with orthopedics. So let's go through what is a remodeling, why it should happen, why we are body is so inefficient in keep on changing our bone. Every 10 years we get a new bone. Whatever bone we are today, 10 years it will be a different bone or a new bone. So we need to understand why this is required in our system. So let's discuss that. So first thing is about this definition of bone remodeling. So in a healthy skeleton, that means your skeleton, Americanco skeleton, my skeleton, it is continuously renewing itself. So it is continuing throughout our life via remodeling process where osteoclast resorb bone and osteoblast form bone. So what is a remodeling? Remodeling is just nothing but your bone, new bone formation, which is continuously happening, but it has to happen in a first osteoclast has to absorb the bone and then osteoblast have to form the bone. And why are we talking about this? Particularly about osteoclast and osteoblast, because there's another way where bone can be formed, which is bone can just lay more bone without absorbing bone, and that is not a remodeling. So, you know, when you have your femur, what your femur is at age of, let's say, where is Mriganko? How do you think bone grow in length and width? Are you there?
Yes, sir, I'm there, sir.
How do you think bone grow in length and how does it grow in width?
So there is simultaneous deposition, reabsorption and deposition around the places of the canal system is there, eversion canal system.
Yeah,
And
is that how bone grow? Bone, what is the role of growth plate?
so through the
That-
physis, the growth happens eventually.
That's enchondral ossification, isn't it? Bone
Yes,
grow
sir.
by enchondral ossification to the growth
Yes.
plate. Yeah, that's longitudinal growth. And on the transverse section or circumference of bone grow by laying more bone. Yeah.
Okay, sir.
Yeah. So that's how bone grows. Saurabh Singh, you want to come?
Yes, sir.
Okay. So bone grow in length. We know mostly grow by physis, and bone grow by laying new bone. And then when the bone is being laid, that is a different mechanism. That's not remodeling. So this bone is being laid here. This bone probably will grow in circumferential. Same bone will lay here, and that bone on a quiescent bone, you keep on laying new bone without osteoclast absorbing the bone. This is a bone growth, or this is bone formation by modeling. And this is a bone formation by remodeling. So you want to differentiate, Saurabh, between two kind of bone formation by modeling and remodeling, or what's the difference between modeling and remodeling?
Sir, remodeling is a continuous process of osteoclast resorption of the bone through osteoclast and deposition of the bone through osteoblast. During growth, when the growth plate is not fused, the longitudinal growth happens, and once the growth plate fuses, the width of the bone increases, or probably it changes regularly on a regular basis.
Yeah, so when you're changing our shape of the bone, we're not actually absorbing bone. We're just laying more bone on cortex, and cortex become thicker. Yeah. All right. And that is bone modeling. So modeling is nothing but changing the shape of the bone or size of the bone as we're growing. Whereas remodeling is a continuous process of bone absorption and bone deposition. So, and we already said it's a continuous renewal of bone. So other than this thing, just talk about Amrita about when you fracture, you want to remodel it. So what is that process called, Saurabh, when you say, let's say you got slightly angulated tibia, and then bone sense that on some side I have to form more bone, on some side less bone. What is that process called?
So that is remodeling, sir.
Yeah, and what is that phenomena or law called?
So Wolff's law.
Wolff's law, sir.
Wolff law, yeah. So Wolff law is followed. That is mean bone resolved and formed according to mechanical demand. That's all Wolff law is. What is Wolff law? That suppose I've got a